Myanmar has great potential for rapid economic development, but the pervasiveness of health concerns within the country is hindering it. Particularly, there are three major public health issues that contribute to this burden: diarrheal diseases, respiratory illnesses, and cardiovascular diseases. Cardiovascular diseases are the top cause of death in Myanmar. Respiratory infections are one of the most prevalent causes of deaths in both adults and children. And lastly, diarrheal diseases are the leading cause of child mortality and morbidity. These serious health concerns can be addressed through an action plan that focuses on three areas of concern that are most essential in improving not only the citizens' well-being, but also the economic health.
Cardiovascular diseases has become one of the major health concerns in Myanmar, with over 3,000 deaths per 100,000 cases. Diseases like stroke, ischemic heart diseases have become the leading killer among the populations. With factors related are unhealthy lifestyle, personal water contamination, and air pollution. Immediate interventions are needed to address the health issue. A balanced diet with limiting the intake of saturated fat, trans fat, and cholesterol, as well as imposing tests on products with high salt, sugar, and fat will greatly reduce the obesity and overweight populations. Also, encouragement on physical activity among different sectors and holding national sports day are helping the general public to adopt healthy lifestyle. Long-term interventions are also essential to improve the health situation. Having the government financial support on building more health and sports facilities in each district can enhance the health care access as well as the access to sport facilities. Subsidizing on low-income classes and also for the general public to have a regular medical examination of
In Myanmar, conditions of the respiratory system are prevalent in serious health issues. In particular, chronic obstructive pulmonary disease, tuberculosis, acute lower respiratory infections, and asthma account for 23% of deaths within the population. Tobacco smoking, secondhand smoke, and indoor air pollution due to solid fuel use are risk factors for these conditions that are easily controllable and preventable. Immediately, the implementation of laws regarding tobacco warning labels, the smoking in indoor areas, and the sale of tobacco to minors will cut down on the use of tobacco significantly. As well, education programs in schools and workplaces focus on the dangers of tobacco smoking, secondhand smoke, and solid fuel use would target all populations about the health risks. Long-term, the subsidization of nicotine replacement therapy and cessation counseling would aid current smokers in quitting, as well as subsidized stoves that use safer solid fuels to combat indoor air pollution. It is imperative that air quality in Myanmar is improved, as well as the population's knowledge of these issues, in order to reduce the prevalence of respiratory conditions.
Diarrheal diseases are prominent within Myanmar. This may be due to the fact that only a small percentage of the population receives treated water, and even then, for only part of the day. Elsewhere in the country, water, if supplied at all, is untreated. Diarrhea-related diseases including cholera, dysentery, typhoid, and viral hepatitis occur widely and are spread through unsanitary urban environments and contaminated water. 90% of the deaths caused by diarrheal disease are of children under the age of 5. Both adults and children in Myanmar have a poor nutritional status and overall health. However, children are more susceptible to severe diarrhea since water constitutes a greater proportion of a child's body.
As recommendation, we have outlined the following three goals. The first goal is to set up system for easier access to clean drinking water for the public. The second goal is to improve air quality by reducing smoke and solid fuel pollution. The third and last goal is to encourage health-conscious decisions and increase physical activity. In conclusion, through the implementation of the above goals, in a well-organized manner, Myanmar has the potential to clear itself from poor dietary practice, unsanitary water, and air pollution. In the long term, educated youth will likely result in a healthier and more productive population, ultimately reviving the declining economy. Implementation of the above goals, along with strong emphasis on educating the young people, would resolve most, if not all, problems faced by Myanmar.